Our biology lesson, which is about the coronary artery disease, done by Alice Beatty. Let's start by our introduction. Coronary artery disease is a narrowing or blockage of the coronary arteries. This condition is usually caused by atheros, atherosclerosis. Atherosclerosis is a buildup of cholesterol and fatty deposit called plaques inside the arteries. These plaques can clog the arteries or damage the arteries, which limits or stops blood flow to the heart muscle. If the heart doesn't get enough blood, it can't get the oxygen nutrients it needs to work properly. This can cause chest pain, angina, or a heart attack, as you see in this figure. What does plaque build up in the arteries? Coronary artery disease starts when you are very young, before your teen years. The blood vessel walls start to show streaks of fat as you get older. The fat builds up, causing minor damage to your blood vessel walls. With time, other substances that move through your blood stream, such as inflammatory salts, cellular waste products, proteins, and calcium, strike to the vessel walls. These things combine with the fat and form plaque, as you see in the figure below. Plaque are different sizes, and many are soft on the inside with a hard, fibrous cap that covers the outside if the hard surface cracks or tears. The soft, fatty inside is exposed platelets, which means the shaped particles in the blood that help form slots, move to the area, and blood clots from around and the plaque. The endothelium can also become art- irritated and stop working properly, which causes the artery to squeeze at the wrong times. This causes the artery to narrow even more. Sometimes the blood clot breaks apart and blood can flow through the area again. Other times, the blood clot suddenly blocks the around of the blood supply to the heart muscle, causing one of the three serious conditions known as an acute coronary syndrome. What about the collateral circulation? If the blockage in a coronary artery slowly gets bigger, new blood vessels may form to reroute blood around the blockage. This is called collateral circulation. This new blood vessels may not be able to carry enough blood to the heart when you are active or under stress, as you see in that figure. Causes of coronary artery disease. The most cause of CAD is a vascular injury with cholesterol plaque buildup in the arteries, known as atherosclerosis. Reduced blood flow occurs when one or more of these arteries become partially or completely blocked. The four of primary coronary arteries are located at the surface of the heart are right main coronary arteries, left main coronary artery, left circumflex coronary artery, left anterior descending artery. You can see them in this figure. Symptoms. The most common symptoms is angina or chest pain. People describe an angina as ashing, burning, fullness, heaviness, numbness, pressure, squeezing, weakness, or dizziness. To speak about the artery after the coronary artery disease causing and development. Let's start about it. Explore this. Say a coronary artery disease means starts with damage or injury to the inner layer of a coronary artery. This damage can even happen when you were a child. Plaque can start to collect along your blood vessels walls when you are young and build up as you get older. That build up inflames those walls and raises your risk of blood clots and heart attacks. The plaque makes the inner walls of your blood vessels sticky. Things like inflammatory cells, lipoproteins, and calcium attach to the plaques as they travel through your bloodstream. More of these materials build up, along with cholesterol that pushes your artery walls out while making them narrower. Over time, a narrowed coronary artery may develop new blood vessels that go around the blockage to get blood to your heart muscle. But if you are pushing yourself or stressed out, then your artery may not be able to bring enough oxygen-rich blood to your heart. Coronary artery disease risk factors are being overweight or obese, age, especially being older than 65, diabetes, family history, gender, high blood pressure and high cholesterol, high stress, lack of physical activity, race, smoking or breathing secondhand smoke, unhealthy diet. That's the end. Goodbye.